So we're on to task number 7 now, which is a heartworm test using an antigen kit. So the one that we use here in-house is the IDEX 4DX plus SNAP tests. These also, beyond testing for heartworm antigen, they test for antibodies for Lyme, Anaplasma, and Ehrlichia. So the difference between antigens and antibodies is an antigen is usually something that causes an immune response. So an antigen is actually off of the heartworm itself. I believe it tests for specifically usually a female adult heartworms that are already in the heart. So sometimes the antigen test is the first line for heartworm testing. If it comes back, it can come back as a false negative, is usually either because there aren't any adult female breeding heartworm developed. This can be caused if it's done too early. It takes about 6 months once the dog is infected for the heartworm to develop into the breeding age. Or if there are microfilaria in the blood, like if the dog was infected but has been on heartworm treatment and the adult heartworm may be dead, but there still might be circulating microfilaria, something like that. So it can cause false negatives. False positives are usually a little more rare. Antibodies, on the other hand, like for the tick-borne diseases, Anaplasma and Ehrlichia, are something that the body produces in response to the infection by those bacterium. So a little bit of a difference there, but this test does for all 4. So what I have here, I have our test from the box. I have a matching conjugate that is from this box. We always label specifically our conjugate, which is obviously labeled number V here with box number, or letter V, box letter V. Always want to use the specific conjugate with the specific box. And I have our sample here. So this was drawn. We had to do some other testing on this dog. So we pulled a green top tube from the dog to do our other testing as well as our heartworm test. You want to use anticoagulated blood for your heartworm test, so either a green top or a purple top is fine. So green top is heparinase, purple top is the EDTA. So what I'm going to do is I always double check my references because I think it's always 3 drops of blood to 4 drops of conjugate, but I always like to double check. Yes, 3 drops of blood, 4 drops of conjugate. So I'm going to take out our tester. Let me turn it down so you can see this a little bit better. Got our tester, and then it comes with a little tube here to measure. Just take our pipette. Drops of blood. And 4 drops of conjugate. 1, 2, 3, 4. And then I'm going to invert this a couple times, about 3 to 5 times. 3, 4. And that just mixes the conjugate with our sample. And then there's a well here, so I'm going to pour the mix in here, and then the blood is going to spread across the show slide here. And once it gets up to the orange, the little circle, then I'm going to snap it down. I always try to get even the last little drop because I find you can't be stingy with trying to get all of the sample out. Sometimes it won't go all the way across. So I'll bring you forward so you can see it's cleared our screen, just coming into the little circle. So we're gonna snap it down. Just press on it really hard to snap it. So now this takes about 10 minutes or so to set, and then we'll read it when it's done. Okay, so I have waited our 10 minutes. The box says 8. For my sake of record keeping, I usually do 10. Typically I end up coming in around 9. So the results are up on our heartworm test. You can see them here. So this little red dot, or not red, sorry, this little blue dot is our control. There are 4 dots that would show up. There's 1 dot that would represent each of the different diseases. So right at the top would be anaplasmosis. If there was one on the far side right here, that would be heartworm. So if that dot came up, this dog would be heartworm positive. The bottom in this little semicircle here, if there was a dot there, that would be Lyme positive. And then if there was a dot here right under our control, that would be Ehrlichia. So this dog is negative for all of those different diseases. So I am going to now pause you and we'll go put it in the record. Okay, so I've kind of got you pulled up. My fingers are here so I can type in as I'm going. This is our screen, so this is the record for our patient FM who we did the blood work on. I already added the line item here that we did the heartworm test for him. So now I'm just going to pull up that this is negative. So I just type in negative there. I'm going to find heartworm. It says heartworm Lyme, EC, which is our Ehrlichia, ANA 4DX. So heartworm Lyme, Ehrlichia, anaplasmosis, our 4DX test. The results were negative. Click that. And then it's posted right here into the patient's record. And it's as easy as that.